morning, everyone. In this lecture, we are going to be covering units 13 and 15. We are skipping unit 14, which covers IV calculations, and that is not something that we typically do, so we're not going to cover it here in this course. So we're going to skip over that. The first unit that we're going to be talking about covers parenteral dosage. And so after we go through this unit, you should be able to calculate dosages using dosage formulas. Also use drug labels to gather dosage information. We've been doing that. Shade syringes to proper dosage per doctor's order, which we've been practicing as well. Convert among systems, we've been doing that. And convert a drug order to a format of the supply on hand. So shouldn't be too much new stuff, right? Pretty much same as we've been doing before. All right, so parenteral medications are medications that are not taken orally. Typically, these medications are in the form of an injection, an inhalant, a patch, a suppository, or so on and so forth. So common parenteral routes are shown here in this chart. The first route is intradermal, and that's abbreviated as capital I, capital D, and that means between the layers of the skin. A good example of this would be our TB test. Intramuscular is the next route on the chart there, and the abbreviation for that is capital I, capital M, and that is usually injected into a muscle. The MMR, measles, mumps, rubella is an example of an intramuscular injection. If you guys have had that, you will notice that soon after, or maybe the next day, that your shoulder is really sore and it might hurt to move your arm around a little bit. The next route is intravenous, and that is abbreviated as capital I, capital V, which is probably something that's already familiar to us, and this means into a vein. All right, so if somebody's getting an IV, most patients get IVs for surgery. There will be a little catheter that's left in their vein so that the anesthesia care provider has access, easier access to give them medications throughout the procedure. And the last one is subcutaneous or sub-Q, and that means under the skin, okay? All right, so injections are mixtures of pure drugs dissolved in some sort of liquid. Remember, a solute in a solvent, which equals a solution. So the dosage of solution strength is going to be provided on the medication label, and it'll typically be given in milligrams per milliliter as a ratio or as a percent. So it's important for us to remember that parenteral doses are calculated based on the amount of drug contained in a specific volume of solution. Parenteral dosages are prescribed in grams, milligrams, milliequivalents, or units. The Do Not Use list from the Joint Commission suggests that the abbreviations for units not be used, and instead we just write units. So here we see in this table some examples. First example is neurotonin, 250 milligrams in 5 milliliters. So the given form is milligrams per milliliter. And how do we interpret this? Well, we interpret it as 5 milliliters of solution contains 250 milligrams of neurotonin. Then the second one is epinephrine 1 to 1,000. This is given as a ratio, and this is something that we will be writing on our medications in the operating room in the role of the surgical technologist very often. So the way that we interpret this is there is 1,000, in 1,000 milliliters, there is 1 gram of epinephrine. And then the last example here, lidocaine 2.5%. And the given form is percent, and the interpretation is there is, in 100 milliliters, there is 2.5 grams of lidocaine. And we'll see this we use local anesthetics in the operating room all the time. 1%, 0.5%, 0.25%, sometimes with epi and sometimes without epi. So it's important to remember that. Remember back to the unit when we talked about a percentage is a part of 100 when we're talking about medications. So here, 2.5% meaning 2.5 grams per 100 milliliters. Or if we had 0.5, that would be 0.5 grams per 100 milliliters. So here is a sample label. It may be like one we might see in the operating room. And so we know already that these labels include quite a bit of information. So take a look at this label and try to identify the different components. What about the name of the medication? Is that generic or trade name? Also, look for the drug form, right? The drug form, it says injection, right? And then there's a little note below it that says for intramuscular, subcutaneous, or slow intravenous use. It also gives us the dosage of medication, which is milligrams to milliliter, right? 100 milligrams of the good stuff to 1 ml, right? And then it tells us the quantity, right? It's a 1 ml vial. We can also see the manufacturer there. We see the warning, the drug warning that says prescription only. And it has some other pertinent information there. I don't see a lot number or an expiration date. I also don't see an NDC number. So what if a unit of measure isn't given? If no unit of measure is given, a ratio or percent will be given instead. So it's critical to remember that in ratios on medication labels, the ratio is grams, or the dry weight or solute, or it could be in milliliters as well, to milliliters, which is the wet solvent, right, which the two combined makes a solution. So it's almost the same for percent. The percent in grams or milliliters to 100 milliliters of the solution, right? So it's always 100 milliliters because, again, percents are based on 100. So ratios need to be converted. So you're told how much drug is dissolved in how much solution. So here we see the ratio 2 to 500. What does this mean? This means that there are 2 grams in 500 mLs of solution, grams or mLs, in 500 mLs of solution. What about 14%? 14% means that there's 14 grams or mLs in 100 mLs of solution. So syringes are used to administer parenteral medications via injection, right? So we see a 1 milliliter syringe here, which is also called a tuberculin syringe or TB syringe, a 3 and a 3 milliliter syringe, right? So the dilution of insulin is such that 1 milliliter of insulin fluid has 100 standard units of insulin. So you can see that there's also a syringe that says 100 units on there. So note that cubic centimeters, not used much anymore, cc, cubic centimeter, we typically use mLs, right? There are some syringes that do still say cc's, but most of them these days say mLs. So let's look at each of these syringes individually. So first, let's take a peek at the 1 ml syringe. So we'll notice that the measurements is in hundredths and tenths of an ml. This is used for injecting less than 1 ml and typically greater than half an ml. Now the 3 ml syringe, that's the one on our right in this image, it is measured in tenths, and it's used when the injection is greater or less than 3 mLs or greater than 1 ml. And then the insulin syringe, which is the bottom left that says 100 units. So this is measured in hundredths and units, and it's used for insulin units. So 1 ml insulin fluid, again, is 100 units of insulin. So this is used for insulin of at least 50 units, but less than 100 units, or equal to 100 units, right? All right, so let's take a peek at these two syringes. Note that they are measured in mLs. All right, it's circled there for us. The top one holds 3 mLs, and the bottom one holds 1 ml. Now let's review parenteral dosages. Don't forget the extra syllable in this word. It is not parental, but parenteral, meaning the medication is not taken orally. So for intramuscular injections, there are guidelines for maximum volumes given at the injection site. This is important for accurate dosage calculation and consideration of multiple syringes. Any dosage larger than the recommended amount is usually checked and verified with the physician, and the dosage is then divided equally or as close to equally as possible, and then given in 2 separate injection sites. We don't really need to worry about that too much as surgical technologists. We do not administer medication. That's not within our scope, but it is within our scope to have an understanding because we are going to be handling, preparing, labeling, and passing these medications for administration. So here's a table that shows the guidelines for how much may be injected for each patient type. So the adult, which is 12 and up, the maximum dose per site would be 3 mLs IM or 1 ml deltoid in the deltoid of the arm. For a child 6 to 12 years, it's 2 mLs. A child 0 to 5 years is 1 ml. And an infant is 0.5 mLs. So in addition to the apothecary metric and household measures, healthcare has 2 other units of measure, just what we needed, right? Commonly used in client medication orders, milliequivalents and units. So 1 milliequivalent equals 1/1000th, and is a unit of measure that's often seen in chemistry and some medications like sodium, potassium, sodium bicarb, potassium chloride. All of these are commonly prescribed in milliequivalents. And then a unit is a standardized amount needed to produce a certain desired effect of a medication. Units are used to prescribe medications such as heparin, insulin, penicillin, and epinephrine, as we discussed before. So here's some good news. No conversions are used because these medications are prescribed in milliequivalents per mLs. So you'll see it written as M, lowercase m, capital E, lowercase q / ml, right? And the labeling is going to match these measures. So to calculate the dosage, there's several ways that we can get from point A to point B. And one way may be to use a dosage formula, ratio and proportion, or dimensional analysis. We've practiced all of those. So you can use any one of these, whichever one makes the most sense to you. Choose that method that you are most comfortable with, and then just use it consistently. For me, I would say dosage formulas and proportions probably are the ones that I am the most comfortable with. You may be more comfortable with dimensional analysis, and that's fine. There's more than one way to get there. You can choose whichever method is most comfortable for you. Okay, so now let's look at a real world problem, and then we're going to solve it 3 ways. All right, we're going to get the same answer each way, but we're going to solve it in 3 different ways. So let's look at the problem. The problem is the doctor has ordered 500 milligrams of ampicillin. Right? On hand is a vial that is labeled 250 milligrams of ampicillin and 5 milliliters. So we're going to look at solving this conversion using a dosage formula, using ratio and proportion, and then using dimensional analysis. So let's look at those now. All right, so solving the problem by dosage formula. Remember, the dosage is D over H times Q. D over H times Q equals our X, or our dosage. Remember, we did this in the last unit. So first you want to identify the D, right, the dosage, and that's what the physician ordered. That's 500 milligrams. Now let's look at what we have on hand. What we have on hand is 250 milligrams, and then what's the quantity? The quantity is 5 milliliters. So we can set this up as 500 milligrams over 250 milligrams times 5 milliliters is going to equal our dosage to be given. The one thing that we have to make sure with this is that the 500 and 250 have the same units, and they do. It's milligrams, right? So this is the way that we would set this up, and then all we have to do is divide 250 into 500 and then multiply by 5, and our final answer will be 10 mLs. All right, so let's look at a second way to solve this. This is by using the ratio and proportion method. So again, we have 500 mLs that the doctor has ordered, and the supply we have on hand is 250 milligrams of ampicillin in 5 milliliters. So here we can set this up as, excuse me, 500 milligrams over X milliliters equals 250 milligrams over 5 milliliters. So when we cross multiply and divide, we get to our same answer of 10 milliliters. Now let's look at solving this using dimensional analysis. So this is the same problem. The doctor has ordered 500 milligrams of ampicillin. We have 250 milligrams in 5 milliliters. So we're going to set what we don't know to the left or to one side of the equation. Here they have set that to the left. And then the dosage unit of measure is 5 mLs, and the dose on hand is 250 milligrams. So we can use this information to solve by placing the 500 milligrams over 1 to form the second factor of the equation. All right, so 5 milligrams is going to be multiplied. It's supposed to be a multiply, sorry. And then remember, we want to cancel out units, right? So we're going to set 500 milligrams over 1, all right, and then that would mean we could cancel out these guys and these guys. It still leaves us with milligrams, right, which is what we're looking for. And then when we multiply 5 times 500, I'm going to come down here, we get 2,500, and then 250 times 1 is 250, right? And then when we divide this 250 up into 2,500, we get 10 mLs. All right, so for me, it feels like the dosage calculation formula is the easiest in this situation, but again, you can use whichever method you would like to get to your answer. Okay, so that concludes our review of Unit 13, and we are going to skip on over to Unit 15. Now, Unit 15 covers basic dosage by body weight. So at the end of the review of this unit, we should be able to calculate dosage by body weight, convert weights between pounds and kilograms, which we've already done, calculate individual and daily dosages, as well as use formulas such as Clark's, Young's, and Freed's rules, I guess they're called, not formulas. So we'll be working with those 3 rules as well. That's kind of the new stuff for this unit. All right, so many over-the-counter or OTC medications for children, such as pain relievers, cold medications, and fever reducers, come in containers that have printed dosing instructions. Manufacturers know that parents know the weight of their children in pounds, so the printed dosage instructions typically comes in teaspoons per age in addition to pound limits. In a clinical setting, the body weight used is in kilograms, and the recommended dosages typically come in milligrams per kilogram or micrograms per kilogram or milliliters per kilogram. So special population drug orders such as pediatric and geriatric medications are often calculated based on weight. Well, these drug orders will state a medication amount per patient weight for a specific amount of time. For example, let's say the drug order reads methotrexate sodium IV 2.5 milligrams per kilogram every 14 days. So the nurse will calculate the dose by multiplying 2.5 milligrams by the patient's weight in kilograms to compute the IV dose to be given every 14 days. So, here, for example, compute the dosing for a 68 kilogram patient. All right, so it tells us that the dose is 2.5 milligrams per kilogram, right? So in order to get how much we need to give every 14 days, we're going to multiply the dose by 68 kilograms, and that's going to give us an answer of 170 milligrams every 14 days. All right, let's look at how it's written out here. All right, so same information that we just went over. The prescription says 2.5 milligrams times the patient's weight in kilograms. And the way we're going to compute this is we're going to multiply 2.5 milligrams, which is the dose, times 68, which is the patient's weight in kilograms, and that's going to give us 170 milligrams. So converting a patient's weight to kilograms requires that we do some basic math first. Remember, we practiced converting pounds to kilograms and kilograms to pounds already. So here are the conversion formulas that we can use to convert those. All right. So just a little note, for calculating accurate dosages, the kilogram weight is going to be rounded to the nearest hundredth. Remember, I talked about how most commonly we round to the nearest hundredth unless it's temperature, which we typically round to the nearest tenth. All right, so let's work through a problem. Okay, so here we have a patient that weighs 32 pounds. So we need to know the weight in kilograms. So remember how we do this? We set this up as a proportion. And our first ratio is 1 kilogram to 2.2 pounds. And then we're going to make sure our units are across from each other. And so we set our X kilograms on the top and 32 pounds on the bottom. And we're going to go ahead and cross multiply. And then we need to divide by the number that's left, which is 2.2. And we get 14.54545454 forever and a day. And we're going to round this to the nearest hundredth. And that is going to give us 14.55 kilograms. So let's look at how we might solve that via dimensional analysis. So what are we looking for? We're looking for kilograms. So we're going to set what we're looking for on one side of the equation. They did it here on the left. How many kilograms? And then our first fraction is going to be our kilograms to pounds ratio. And then we're going to multiply that by the pounds over 1. So this allows us to cancel our units of pounds, and then we multiply straight across. 1 times 32 is 32, 2.2 times 1 is 2.2, and we divide and we get our same answer. So whichever way is comfortable for you, go ahead and use that method. Okay, so what if we have something like 14 pounds, 4 ounces? How do we get that to a decimal so that we can convert to kilograms? Well, remember there is 16 ounces in a pound. So what we're going to do is we're going to take that 4 ounces and we're going to set it over 16, right? Because 1 pound equals 16 ounces. So when we do that, we get 14 and 4/16 pounds, and we can reduce that down to 1/4. And when we divide 4 into 1, we get 14.25 pounds. Now we can convert to kilograms. Let's look at another example. Let's say we have a patient that is 25 pounds, 10 ounces, and we need to convert that to kilograms. So again, we're going to take the 10 and we're going to set that over 16. So 25 pounds, 10 ounces becomes 25 and 10/16 pounds. Remember, we get that because 1 pound equals 16 ounces. We can reduce and then divide 8 into 5 to get our decimal, which is 0.625. So our pounds is 25.625 pounds, and now we can go ahead and convert to kilograms. And then we'll remember to round to the nearest hundredths, which would give us 25.63 pounds. All right, so let's look at a real life problem. So once we've converted the weight to kilograms, our next step is going to be to calculate the dosage by multiplying the dose ordered by the weight in kilograms. So remember, when weights consist of pounds and ounces, we first have to get the ounces into a decimal, and then we round to the nearest hundredth. Then we can convert to our kilograms. Right? Remember, we're going to also round to the nearest hundredths place. So let's look at this problem. So the nurse receives a medication order for a child. Vancomycin hydrochloride, 40 milligrams per kilogram per day in 4 divided doses for 10 days. And it's not to exceed 2 grams per day. So the child weighs 34 pounds 6 ounces, and they want us to find what is the total daily dose and what is the individual dose. So first we have to change our pounds and ounces into the decimal form. So remember, the way that we do this is we take our ounces and we set that over 16, and we get 34/6/16 of a pound, and then we reduce, we divide the denominator into the numerator, and we get 3.75. And now we need to round to the hundredths place, and so we look at the number to the right of the hundredths place, and that is a 5. And if it's 5 or greater, we add 1 to the hundredths place. So that's going to give us 34.38 pounds. And now we can go ahead and do our conversion to kilograms. So go ahead and do that conversion now, and then we will look at how to work it out together on the next slide. Okay, how did you do? If we set this up as a proportion, kilograms over 2.2 pounds is equal to x over 34.38 pounds. Cross multiply and divide, we should get 15.6272, and then we need to round to the hundredths place, which gives us 15.63 kilograms. Right. So now we know our kilograms. We can work on finding out the total daily dose and the individual dose. All right, so remember, the problem told us that the order was for vancomycin 40 milligrams per kilogram per day, right? So how we figure out the daily dose is going to be to multiply our 40 milligrams, which was ordered, times the child's weight in kilograms, which is 15.63. And when we do that, we get our daily dose in milligrams, which is 625.2 milligrams per day. All right, that's the daily dose. The daily dose. And it says that it's to be divided into 4 doses. So what is the individual dose? Well, the individual dose, to get that, we take our daily dose, which is 625.2 milligrams, and we simply divide that by 4. And that's going to give us 156.3. Now, there's one other thing that it does say, and sometimes we might have to check this, it says not to exceed 2 grams a day. So are we within that requirement of not exceeding 2 grams per day. Well, let's look at our daily dose. And if we were to convert that to grams from milligrams, we would move our decimal point 3 jumps to the left, which would give us 0.6252 grams. And that is definitely less than 2 grams. It's less than 1 gram, right? So we would be good there as well. All right, so now let's look at 3 special formulas for dosage by weight, for calculating dosage by weight. The first one is called Clark's rule. Clark's rule is used for pediatrics and youth with normal or lean body mass and normal development. The second rule is called Young's rule, and it's used for individuals 1 to 12 years old, and it is based on age, and it is considered the standard formula for dosage calculation. Young's rule is the standard one. And then lastly, Freed's rule is used for infants up to 2 years old. So Clark's rule is used to estimate the proper dosage of medication for children from ages 2 through 17, and it is based on weight in pounds, not the kilograms. For example, if a child weighs 25 pounds and the adult dose is 250 milligrams, your equation would look something like this. The weight of the child over 150 pounds times the average adult dose is going to equal the pediatric or child dose. Okay, so let's look at an example using each of these rules. So the first one we're going to look at is Clark's rule. Well, Clark's rule, remember the formula is weight of the child over 150 pounds times the average adult dose is going to equal the pediatric or child's dose. So the situation is we have a child that weighs 25 pounds and the average adult dose is 500 milligrams. All right, so go ahead and work this out on your own, and then we will work it out together. So let's plug in the information for our formula. The weight of the child is 25 pounds, right? So let's go ahead and do our 25 pounds. Okay, and that is going to be set over 150 pounds. And then we're going to multiply that by the average adult dose, which it said is 500 milligrams. 500 milligrams. All right, and that's going to give us the dose. All right, so the easiest way to tackle this is to first divide our 150 into 25. And when we do that, we get 0.17, right? And then when we multiply that by 500, we should get approximately 83 milligrams. It actually works out to be 83 and a third repeating. So that's going to give us 83 milligrams is the child dose. Now you can multiply straight across to solve this as well. 25 times 500 would give us 12,500, and divide that by 150, and we get to our same answer, right? Now let's look at the formula for Young's rule, which is the standard, right? Young's rule is based on age in years to estimate the proper dose. So the formula for Young's rule is sometimes easier to remember if you think about age and young. This is a mnemonic device to help us remember that the rule is based on the age of the child. And so the formula for that would be age of the child in years divided by age of the child in years plus 12. So we're going to add 12 to whatever their age is. And then we're going to multiply that by the average adult dose to get the pediatric or child dose. Let's look at an example using Young's rule now. So remember the formula for Young's rule is age of the children in years over the age of the child plus 12 times the average adult dose. So together. All right, so age of the child in years, that is 2, right? That is going to be placed over the age of the child in years plus 12. So 2 plus 12, right? 2 years, and then we're going to add 12. That gives us 14. All right, and we're going to multiply that by the average adult dose, which is 500. And that is going to give us our pediatric dose. If I can get my pen to draw a line. Okay, so 2 ways we can solve this. We can divide 14 up into 2, get our decimal point, multiply by 5, or we can think of this 500 over 1, and we can multiply straight across. 2 times 500, we're going to get the same answer either way. Let's just do it this way. We get 1,000, right? And then when we multiply 14 by 1, that gives us 14. And then we simply divide to get our decimal, which is approximately 71 milligrams. All right, so that would be our child dose. And then lastly, Freed's rule uses the child's age in months to estimate the proper dose. And so the formula for that looks like age of the child in months over 150 pounds times the average adult dose is going to give us the pediatric or child dose. Okay, let's look at one more example using Freed's rule. So remember, the formula for Freed's rule is age of the child in months over 150 pounds times the average adult dose. So go ahead and work this out and then come back and we'll work it out together. Okay, so age of the child in months, what is that? That's 8, right? So we have 8. We're going to put that over 150 pounds. We're going to multiply that by 500, which is the average adult dose. It told us 500 milligrams. And when we can do this one of 2 ways. We can start by dividing 150 into 8, get our decimal, and multiply by 500. Or we can multiply straight across 8 times 500 and then divide by 150. Either way, we get approximately 27 milligrams. It works out to actually be 26 point, a bunch of 6s, so 26.67 if we're rounding to the nearest hundredth. If we're rounding to the nearest whole number, then that would be 27 milligrams. All right. All right, and that's our answer. Thank you everyone for listening to this lecture, which is our very last lecture in this course. So it's been super fun being able to share some math concepts with you and just help you along the way of honing your craft in math. And one step closer to becoming a certified surgical technologist. So thank you for listening to this lecture. Thank you for all of the work that you have put forth in this course, and I look forward to answering any questions that you might have on this material.